For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Hello and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Christian Moises. October is here and that means Breast Cancer Awareness Month, and you're going to start seeing a lot more pink around town. But there's a lot more to this disease than pink ribbons, which is why we have 3 guests here today to talk about everything you need to know revolving around breast cancer. First up, we're joined by Dr. Carrie Marquette, an oncologist with Northshore Oncology Associates, which partners with Mary Bird Perkins Cancer Center at St. Tammany Parish Hospital. It was a mouthful, but I'm glad you're here today.
Thank you for having me.
Tell us a little bit about yourself, your role with Northshore Oncology and how that relates with your patients at Mary Bird Perkins Cancer Center, and kind of how you got to where you are today.
Well, I'm one of 3 medical oncologists who works in our office in Covington, and we also work with the other radiation oncologist through Mary Bird Perkins in the building that also offers additional services such as social work, dietary. So it's really a comprehensive approach to cancer care that we have there at Mary Bird Perkins.
And breast cancer, of course, is something that y'all probably see a lot of, not just in October, but throughout the year. So tell me a little bit, we'll kind of dig into what some of the risk factors, some of the facts, the basics of breast cancer are.
While breast cancer is the most commonly diagnosed cancer in women, it's the second leading cause of death, cancer death in women. In 2014, there were about 230,000 predicted cases of breast cancer in the U.S. About 62,000 cases will be of carcinoma in situ, which is a form of precancerous lesion, pre-invasive lesion, similar to a polyp on a colonoscopy. But yet another important finding that needs to be diagnosed and treated appropriately. About 40,000 women will die of breast cancer in 2014 in the U.S.
And how prevalent is breast cancer in St. Tammany Parish?
We see a lot of breast cancer. I mean, I wouldn't be able to give you the percentages, but I would agree that it's probably the most common diagnosis that we see in women. Between the ductal carcinoma or lobular carcinoma in situ and the invasive cancers, we see a lot of breast cancer, and it's likely our most common diagnosis in women.
Right. And by the time that they come to you, they've already been diagnosed, so you're more on the treatment end at this side. Let's talk a little bit about the treatment that's available and exactly what you do to treat this disease.
Yeah. Well, there's really 4, in my mind, modalities of treatment for breast cancer. The first step is oftentimes surgery. Another field that's separate than mine would be radiation oncology. And then what I'm involved in and what I administer is the other 2 types of treatment for breast cancer. And those are chemotherapy and hormonal therapy. So depending on the type of breast cancer you have, and breast cancer, as time goes on, we're learning is a very diverse group of diseases actually. And so depending on the stage of your cancer, the specifics of the tumor, the phenotype of the tumor, and the patient characteristics, different patients will be a candidate either before surgery or after surgery for chemotherapy and then hormonal therapy as well.
Now, we're kind of working backwards in our conversation here, but you talked about stages. Can we talk a little bit about the different stages of breast cancer and kind of how that affects patient care and what patients may expect to experience in each stage?
Patients who have stage 0 disease, which would be considered the carcinoma in situ, their survival at 5 years is about 100%. Same with the stage 1 breast cancer. The survival at 5 years is about 100%, so it's a very curable disease. Patients with stage 2 disease, the survival at 5 years is about 93%, and stage 3 disease, the survival at 5 years is 72%. So those are still very curable diseases. The survival at 5 years of patients with stage 4 disease is about 22%. And I think that these numbers are probably improving. Over the last 5 to 10 years, there have been a lot of advances in my specific world of medical oncology. So we've had changes in recommendations in the duration or type of hormonal therapy that we're giving patients. We've also made changes in the chemotherapies that we're using as well. And there are many new chemotherapies on the market, as well as new targeted agents for things such as HER2 positive disease. And they're looking into there's always ongoing research into additional targets for early stage and metastatic breast cancer that I think we will see improve these survival numbers.
Right. Continue to move backwards even more. Let's talk a little bit about the risk factors that may lead to breast cancer. If people are predisposed through hereditary disorders or age.
Sure.
What are some of the top qualifiers? The
biggest risk factor for breast cancer is being a woman. While men can get breast cancer, and we do see that, the likelihood of a woman getting breast cancer is about 100 times the likelihood of a man developing breast cancer. So it's much more common in women. So that's probably the biggest risk factor. The second risk factor is age. As you get older, your risk of almost every type of cancer increases. While there are a lot of breast cancers seen in younger women, I think it's surprising how many young women we see in our clinic. About 1 in 8 invasive breast cancers are diagnosed in women under the age of 45, while about 2 in 3 are in women over the age of 55. And we see breast cancer in the entire spectrum, from the 20s to the 80s. Right. And age does impact, your age and your physical stamina impacts how you're treated and how we approach the disease. Another risk factor is genetics or family history. I think you hear a lot about the BRCA1 and BRCA2 gene mutations, and while those are very well known, it's not very common that we find those. Probably about 5 to 10% of patients have a hereditary breast cancer, but not all of those patients have a proven BRCA1 or BRCA2 mutation. In addition to those two most commonly known probably in the general population, there are additional familial cancer syndromes. So we often are asking patients about other family histories of cancer, such as colon cancer or endometrial cancer, other things that may fit into other familial types of cancer syndromes as well.
Does diet have anything to play into this at all?
I think that diet is a really difficult question to answer, and people ask this all the time. Certainly, a healthy diet cannot hurt. Doing studies on diets are very difficult because in order to show a correlation between a diet and a disease, you have to have good control over the population's diet in the study. And it's very hard to control diet in a study, just like it's hard for people to maintain a certain diet. What we have been able to show, and what was seen again in some abstracts I saw at ASCO, is that in women who've been diagnosed with breast cancer, the recurrence risk is higher in women who are obese. So we do know that regardless of what your diet is, if you are obese, your risk of recurrence is higher. So what I encourage most women to do is just maintain a healthy lifestyle. However, you can maintain a healthy diet and exercise and maintain a healthy weight. Mm-hmm. I think that that's something that we've proven to be effective. And after diagnosis. And so I think that that's something that you could extrapolate in a way to prevention as well.
Now, if we could real quick, talk about signs and symptoms.
Sure.
And we'll get to something after that.
So it's interesting. There are some patients who present to our clinic who have a mass in the breast that they've noticed on self-breast exam, or sometimes after, they're doing something in their hair and, brush up against something. And then there's a lot of women who present with absolutely no symptoms and are sent to us based on screening mammography. Other symptoms would be changes in the skin, so overlying skin changes, skin thickening, skin redness, sometimes pain, nipple distortion or nipple drainage in a woman who's not lactating. Those would be symptoms that would prompt a woman to go have a screening mammogram and get further evaluation.
And screenings are hugely important. Mary Bird Perkins Cancer Center does a lot of screenings. We have several that we're sharing with our viewers right now that are happening in October and November. Tell me the importance of screenings. We can't stress that enough to the public. We do it with our colon cancer and prostate cancer. Breast cancer is no different. You want to get screened early. Exactly.
So we talked about survival rates earlier, and the survival is impacted by the stage. And so if you can find an earlier stage breast cancer by screening, which for most patients is mammogram, then your overall survival is improved. And so we encourage women to get regular screening mammograms. There are some women who actually should be screened more aggressively. Those would be women who have a very strong family history or who have known genetic mutations. Sometimes we'll change the screening recommendations to mammogram alternating with breast MRI, things like that. But that's something that your doctor could make more specific recommendations about.
Right. Well, Dr. Marquette, thank you so much. We could probably talk for hours about this and still not get all the information. There's always information on Mary Bird Perkins' website. There's always information on stph.org, St. Tammany's website. But thank you again for being here so much. And when we return, we'll be talking about what happens on the non-clinical side, how you can cope if you have been diagnosed with breast cancer.
Good health. It's all about balance and staying in tune with your body. But intuition isn't enough. Having regular screenings is vitally important to your long-term health. And now, the latest advances in diagnostic technology can be found in a beautiful, relaxed atmosphere. Introducing our all-new Women's Pavilion, dedicated to the healing arts and clinical needs of women. St. Tammany Parish Hospital. World-class healthcare for women close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. We're talking all about breast cancer today. We just finished talking with Dr. Carrie Marquette from Northshore Oncology Associates, all about the clinical side of breast cancer. We're now joined by Jane Freudenberger, a licensed social worker with Mary Bird Perkins Cancer Center at St. Tammany Parish Hospital. And you're going to fill us all in about what happens on the non-clinical side, how to cope with being a breast cancer patient and even a survivor. So thank you for being here today.
You're welcome. Thank you for inviting me.
Tell me a little bit about what you do with the cancer, what your role is with the Cancer Center.
Yeah, my job runs the gamut of really trying to address some of the psychosocial needs that our patients, as well as family members, are experiencing at the time of diagnosis, through treatment, and on into survivorship. So as I tell folks, my job is to try to see what sort of resources are available to meet some of the barriers they're experiencing. And barriers run the gamut from some of those practical concerns, such as, I don't know how I'm going to get to my daily radiation treatment for 6 weeks, to I've got to take time off from work and it's affecting how I pay my bills. I need help with, say, some foundations that might be able to give some day-to-day financial assistance. Other barriers that people experience are, I don't know how to communicate with my family members about what's going on, how I'm feeling, how to talk to my children, how to talk to my mom and dad about what's going on with my diagnosis and how I'm feeling. And then certainly our patients experience feelings of distress associated with a life-changing diagnosis that cancer brings. And so I'm available to either provide direct resources to our patients through short-term counseling, to helping folks find financial resources, for example. But a lot of what I do too is pointing people into resources to meet their needs, such as national or local agencies to help with them. So a lot of trying to troubleshoot and direct people to where they can get some help.
And getting any cancer diagnosis, whether it's breast or colon or prostate, is big news. So while we'd love to be able to talk about how to cope with each one of those bullet points you were just talking about, can you kind of walk me through how you would talk with a recently diagnosed patient and you know, maybe somebody out there is watching that just received a diagnosis. What do I do now?
Absolutely, and those are those questions that are running through people's brains, and you're just on this adrenaline high and trying to cope with all these questions and concerns that they have. So I always tell people, first thing you got to do is breathe. Have to slow down that breath. We do know that deep breathing kind of slows down that fight or flight response, and we can't think, we can't respond appropriately if we are just really agitated internally. So deep breaths, and that's why meditation, yoga, Tai Chi, all those support services can be helpful, but just some deep breaths. But then secondly, start writing down questions and concerns. I know that if I wake up in the middle of the night and I'm concerned about something, I just think about it and my brain won't shut off. So it's important to get up and write that down. Right. That act of writing down is actually soothing for so many people. So writing down your questions and concerns to take to the doctor, and bring a friend or family member with you to those doctor's appointments for those.
I was going to say, and that's a key of this is your support network.
Absolutely. Enlist the support of your family, your friends, your faith community, even your employers. There are friends who will probably come out the woodwork and want to help, and so many of us, especially as women, we don't want to ask for help. We are superwoman and we can do everything. Well, you know, if our girlfriend was facing diagnosis, we would do everything we could to help her. Why don't we allow the same for ourselves? So you don't have to have everything under control all by yourself. Reach out to those
definitely
people.
Don't go it alone.
Don't go it alone. There are support groups out there that for breast cancer we have at the center, a breast cancer support group, as well as a young breast cancer support group called Survived At. Those are wonderful ways to network with other women who are going through similar experiences to help normalize what's going on and to get ideas.
And those are free. They're listed on our website. We're constantly pushing them. Local newspapers, on our websites. Definitely take advantage of it.
Absolutely. Other support networks nationally, Livestrong Foundation, Cancer Care, they offer free telephone support counseling for caregivers as well as cancer survivors. So those, I try to link people up with those resources. Certainly we want people, as Dr. Marquette mentioned, to exercise. Exercise is proven health benefits, but also mental health benefits. It's that emotional release you get from a nice walk. Certainly talk to your doctor. Eating a balanced diet, staying well hydrated. It's amazing the mood changes that occur when you're not eating healthy, and even mild dehydration.
And speaking of kind of going back to what we were talking a little bit ago about questions that you'll get, what outside of that first initial, you know, shocking news question, what are some of the questions you get specifically about breast cancer? And how do I cope with this?
Right, a lot of it is I'm going to lose my hair if they have to go through chemotherapy. That's a major challenge, certainly for women. Hairs are so important to us. So let them know we do have a wig boutique with hats, scarves, wigs, but also putting them in contact with other women who have gone through it and helping them to see that they're not alone, that they're not ugly, that they're beautiful. We have a skincare workshop quarterly called Look Good, Feel Better, and that's another way to network with women and address some of those physical appearance. A lot of women naturally worry that with chemotherapy and radiation they may have a lot of physical discomfort, and so through our patient navigation program with our chemotherapy nurse educator, the dietitian, myself as a social worker, we can really address some of those fears and concerns that they will have about how they'll feel physically.
Right.
as well as emotionally. So doing a lot of listening is a huge step in helping people cope with the diagnosis. People just want to be heard and listened to and validated.
And that goes back to what you were saying, you don't have to do it alone.
No.
There are these support groups, there are these great professionals, physicians, social workers at the Cancer Center that are there to help you through this.
Yes.
So definitely take advantage of those resources.
Yes.
What else is there that patients and even survivors can continue to do to cope with this?
I'm so glad you brought that up, because one of the coping mechanisms is to have fun. You are not your cancer. You do not have to think about your cancer 24/7. Our brain needs those opportunities to shift gears, and so we always tell our patients, continue to do those things that you enjoy as much as your body permits as you're going through treatment. Go to your kids' baseball games and soccer games. Go on date night. Go out to the beach with your girlfriends. We had a patient recently, she had an annual beach trip with her girlfriends. She was going through chemo. She couldn't sit on the beach, but she just gained so much from just being with her girlfriends, sitting in the condo.
Continue to live your life. Seize the day.
Seize the day, and truly it is taking advantage of the day at hand. I often tell our patients and family members to keep a gratitude journal. We forget that there are still good things happening in our lives, and that can be a very powerful tool to help remind yourself and as a family, there's still good things happening.
Right.
So go out, get your nails done.
Well, Jane, thanks so much. I appreciate you being here today.
Welcome. It's my pleasure.
And when we return, we will have the third part of this discussion about how you at home can help support breast cancer awareness and help these patients.
They're the movers and the shakers. They're the ones who change our world. And they deserve places designed especially for them, built with kids' specific needs in mind. The latest technology in the caring hands of our dedicated pediatric specialists and primary care physicians, helping kids feel like kids. St. Tammany Parish Hospital, world-class health care for children close to home.
Welcome back to Healthy Living. We are talking about breast cancer. We've been talking a lot about the clinical and non-clinical coping mechanisms, signs and symptoms and whatnot. Jane Freudenberger, a social worker with Perkins Cancer Center at St. Tammany Parish Hospital, was just talking about how you don't have to go through this alone for the patients. We're now joined by Leslie Landry, who is Director of Development at Perkins Cancer Center at St. Tammany Parish Hospital, who's going to talk about how you can, at home, can help those patients get through their issues.
Absolutely. Thanks
for being here.
Thank you.
So tell me a little bit about what the foundation and the development office at the Cancer Center does.
Okay, well, as I am Director of Development, I am responsible for implementing a comprehensive philanthropic program which raises awareness and support for the communities in which our Cancer Center serves. So I'm responsible for overseeing any fundraising activities and events in the community, providing guidance and support for third-party events that may take place in the community, such as runs, walks, anything that people can think of, hosting raffles, that kind of thing. I'm involved a little bit every step of the way in providing any type of guidance and resources that they may need. I'm also responsible for a signature cancer fundraising event, which is our Benefits of Home Gala. And I work with the community and businesses, individuals, and just kind of developing a relationship and seeing if there's any partnership opportunities for their business to become involved, if it is something like a cause marketing agreement, which is selling a product or service while also benefiting the Cancer Center at the same time. Now, everything that I just mentioned, when we are raising funds and creating that awareness, all the funds that we raise here in St. Tammany Parish stay in St. Tammany Parish, and 100% of the dollars that we raise go to directly fund patient support services. So early detection, education, such as tobacco cessation, and the medical physics program, that's an education component. nutritional supplements, transportation assistance.
And does that include like Tai Chi and meditation programs
also? It does.
Also?
Tai Chi, meditation, and yoga all kind of fall under our survivorship program, our survivorship category. Also, what falls under survivorship is our navigation team. When a patient comes in to begin their treatment, they meet with our navigation team and they learn about their chemo in chemo school, and they talk with Jane, our social worker, who y'all just spoke with, and they just make sure that their journey is the best it can be and their outcome is successful.
Now, October, of course, is huge for breast cancer, and it seems that we're seeing more and more pink every year for Breast Cancer Awareness Month. What are some of the programs that people at home can do to support awareness and kind of help those patients out?
Sure. We have one single campaign. It's called the Go Pink campaign. We implemented 3 years ago, and it has grown exponentially over the years. When we started 3 years ago, it was raising about $20,000, and as we closed last year, we raised about $60,000. So what is Go Pink? Go Pink is just a platform to encourage our community, our individuals, our schools, businesses, sports teams to join the fight against cancer and do something small. Examples of what a Go Pink program might look like is having a pink dress down day within your office. You know, asking your employees to pay $5 to wear jeans and a pink t-shirt on Fridays. It could be a football team at a local high school dedicating a home football game and collecting donations at the football game, and the football players wearing some sort of pink. You know, that's kind of getting to be pretty big in the NFL, and those boys love to do that, and it's easy for them to get involved and feel like they're a part of the fight against cancer. So many different things that Go Pink can kind of gear towards: softball tournaments, raffles, anything like that. You can basically turn anything into a pink event.
Now, what are some of the specific breast cancer programs that your office kind of works with and helps fund and continue?
We have a young breast cancer survivors group. They're a support group that meet. We have Survive That is a breast cancer group. We provide camisoles for mastectomy patients. And then, of course, our regular programs, you know, providing wigs for patients, and that kind of falls within all patients. So
you're always out and about throughout the community. Y'all are always partnering up with local businesses and
yes.
whatnot. How often do you see former patients and survivors coming back to help fund these programs? Is it a very organic, fluid process? It
is. They either join a committee, which is one of the ways you can get involved with our cancer center, join a committee to be a part of a fundraising event, or they host a Go Pink party themselves. You know, I had a patient last year who just wanted to give back because she had such a great experience, and she hosted a Pekino night in her home, and it was a Go Pink Pekino. And she did very well. She raised nearly $1,000 just having this one little Pekino game in her house. So yes, our patients do come back and want to get involved, and they want to give back. But they also give back in different ways. They come in and they volunteer, and they want to be with the other patients and helping them get through the process. And they want to honor those people who help them through the process. And we have a program for that. It's called Heart of a Hero. It's our tribute giving program, and that enables them to nominate their heroes and honor them. And it's a great way to say, thank you, thank you for helping me get through this journey and lessening that burden of cancer for me.
And that's a huge thing, I think, too, is a lot of people will be asked, raise money for breast cancer awareness, but a lot of people don't know where it's going.
Right.
So it's been really nice to hear about the programs that y'all are doing. You can actually see your former patient who had the Pekino night. It's good to see that that $1,000 is being reinvested into all these different support groups and whatnot.
Yeah, and not just support groups, but free breast screenings in the community. We're setting up the mobile medical unit in parking lots around St. Tammany and Washington Parish, providing that free breast cancer screening. With doctors on site, physicians on site. So a lot of our dollars that we raise go to early detection and screening programs as well.
Which is the benefit of keeping it in St. Tammany Parish.
That's right.
And that was something else you had talked about, the screenings. The benefit is that a lot of these dollars that you're raising through your office are not just for breast cancer, even though that's what we're talking about this month. It's covering all cancers in St. Tammany Parish.
It is. It covers every cancer, and it has a direct and immediate impact on patients and patient support care and services. So it's incredible how our community has come together to fight this disease, and the passion and dedication that I see within St. Tammany and Washington parishes just makes me feel honored to be a part of this community.
So I guess you'll be seeing me in pink every day this month. I gotta go buy some more shirts, but
yes.
Leslie, thanks so much for being with us today. I appreciate it.
Thank you.
And thank you for watching today. We'll have information throughout the month on all of our social media accounts, Facebook, St. Tammany Parish Hospital, Twitter, LinkedIn, and of course always check stph.org for the latest information and events going on at the hospital. Thanks so much, and we'll see you next time.